Testing, testing. Testing again. Testing again. Okay. Yeah. Blastocyst. The blastocyst is a young embryo.
So when it's like that 6 or 7 days.
More or less. So more or less, the blastocyst, the trophoblast cells pump salts into the interior of the embryo. When you pump salts, what comes with it? Water. That causes the embryo to cavitate. When it cavitates, it's a blastocyst. It stops being a blastocyst once it gastrulates. So day 14, it's no longer a blastocyst. Some would say before that. There's this term that was used, pre-embryo. That term pre-embryo was completely designed, not because of any embryological fact, but in order so people could work on embryos and disassemble them and salve their consciousness.
Recording.
Hey, Stephanie. Can you hear me all right? All right.
Yes, I can.
Good. All right. Good. All right. So Stephanie, you'll have to come in and make up the quiz sometime. The office will be closed next week. So if you can come in, I'll be here next week because of spring break. So just contact me and we can set up a time when you can make it up.
Okay. All right. Thank you.
Sure. All right. You're from Grand Rapids, right? Yeah, not that far of a drive. Do you take the 131 or do you take the 96?
I go to 96 because my car doesn't have like a Bluetooth radio, so I look at transmitter. And when I go through town, there's like a radio station.
Well, that's one reason. Yeah, I saw Haley leave earlier today. She was in a pickup truck with somebody. They left all packed up and ready to go. So.
One and 5. Oh, yeah, the same question.
Well, lucky for you.
You guys all get that right.
Well, if you get it wrong and you get it wrong twice, that'd be. Or you can hedge your bets. No, answer them both the same. You either know it or you don't. Must have been a really good question. I liked it so much.
Thank you.
Ooh, that wasn't your computer, was it? Very good. I hope you guys have a great break. Please drive safely. And Saturday is supposed to be gorgeous. So enjoy the weather, go for a bike ride, go for a run, have a picnic, you know, whatever. 70-degree weather is going to feel like sweltering. And then it's supposed to snow on Monday. Yeah, I just can't get away from it, can we? Very good. So we are talking about development and things that go wrong during development. Your book on page 61 has what I think is a really helpful little figure that shows you when your particular organ systems are most susceptible to the types of deformations that will cause major morphological abnormalities. You can see there that the different colorations will tell you essentially whether or not you have the more severe. It doesn't mean that when you're outside this period, there can't be any structural insults, so to speak, to the structure. It just means that the more severe ones are not usually possible. So notice that if you hit the development earlier, that's worse than doing it later. Affecting development earlier tends to produce more severe abnormalities. That's kind of the rule. And so with that rule in mind, if you look essentially at this table, I don't know if you have your book with you or not, or just make a note to look at page 61, figure 4-2, that the pink zone there essentially corresponds quite effectively to the time of formation and major morphological events. So the heart, for example, yes, the heart starts beating at the beginning of the 3rd week, about day 22. But the heart starts out as a tube. You have essentially 2 chambers, and then the heart literally will do this. And that rearrangement that it does is massive. There's a lot of interesting gene expression that goes on, and it not only rearranges, it has to turn the right way. If it turns the wrong way, it can get all tied up in a knot and all really screwed up and so on and so forth. So it has to, it's just this tube, it's going to, so the atrium originally is down, and then the atrium essentially comes up, and then it swings around like this. And then you have still 2 chambered, but then it's going to eventually start to make partitions so that you get a left side and a right side. The ventricles now will become more muscular than the atria, and then you get the outflow that is elaborated, and the vessels coming to, as the embryo gets bigger, it's going to need more blood vessels. The circulatory system is constantly remodeling itself during this time to accommodate to the increased needs of the embryo and then the fetus as well. So the vessels coming in and then the vessels flowing out undergo this pretty massive remodeling. And those are the times during which you can have the greatest abnormalities. The rest essentially is the heart getting larger. And then also as the lungs get a little bit bigger, a little bit bigger, a little bit bigger, a little bit bigger, a little more mature, a little more mature, a little more mature, boom, we're ready to go. The lungs are really the last organ to fully mature. If any work neonatal, don't need neonatal. So If a baby's premature, what's the main reason the baby doesn't survive? Lungs, yeah, lungs. If a baby comes out too early, it's lungs. It's usually lungs are the issue. You can't, because the respirator, on the baby respirators, you can only put air into the kid at a certain pressure. Put it at any greater pressure, you're going to explode the kid's lungs. And you can give corticosteroids to help mature, well, glucocorticoids, sorry, to mature the lungs, but that takes time for the lungs to be able to essentially catch up with the needs for the baby. You can't use ECMO on a baby. So the baby has to breathe on their own. And that's usually the main reason why babies, if they are born too early, they're not going to make it. It's lungs, because the lungs are really the last organ to really come online. The lungs develop very gradually, branching and differentiating into conductive zone and respiratory zone and so on and so forth. And if I had more time to tell you about it, I would, but I don't. Anyway, as you see here, the earlier you hit it, the worse it is essentially for that structure. So between 10% and 12% of all newborns will have some sort of birth defect that can be, and again, that's being very generous. What's your definition of birth defect? Say, for example, if one of you had toes that were fused, that would be an example of a birth defect. Now, can any of us see it? No, you have shoes on. But that would be an example of a birth defect. If you need glasses, that would be an example of a birth defect. If you have any sort of, maybe you have an extra digit or something like that, that would be an example of a birth defect. Did you know Anne Boleyn, Henry VIII's second wife, apparently has 6 fingers? Yeah. Her trial, she was accused of witchcraft. And that was one of the things that was used as evidence, that she had 6 fingers on both hands. Yeah, Caitlin was about ready to faint saying, gee, that's not a very good reason to divorce somebody or cut their head off for that matter. But, and Caitlin, I would completely agree with you. Yeah. Now, sometimes these can be due to some sort of developmental abnormality that was induced during the pregnancy, because the baby was exposed maybe to drugs that can cause certain types of developmental abnormalities. Or maybe there were actual genetic reasons, mutant genes, chromosomal defects, blah, 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 so on and so forth. So there's lots of reasons why a kid might not be able to survive, or why the child might be born with some sort of abnormality. Again, there's no huge mystery there. Now, there are some drugs that have been studied in some detail because the type of abnormality they cause is well understood. How they do it is well understood. And therefore, the types of morphological abnormalities you get tend to be pretty reproducible. So agents that cause developmental abnormalities, they're called teratogens. And teratogenesis very simply means causing developmental defects to a baby. Teratogens are dose dependent. Not only are they dose dependent, they tend to be time dependent. When the baby is exposed to them tends to be quite important. Well, we talked about this a little bit with NSAIDs when we were talking about NSAIDs, how NSAIDs after 30 weeks can be pretty deleterious to the developing baby because they can prevent closure of the ductus arteriosus, so they can cause premature closure of the ductus arteriosus. Early on, they can be deleterious because the kidney, yeah, kidneys aren't on there, but they can prevent development of the kidney. So they're dose dependent, they're also time dependent. So let's talk about thalidomide. So thalidomide was used to treat morning sickness. Today it's used to treat multiple myeloma. That's what MM stands for. And then it's used for other things that you see with HIV, the wasting, the sores around the mouth, and so on and so forth. It was prescribed as a morning sickness drug. It wasn't a very good morning sickness drug for that matter. It only was prescribed in Europe. It was not prescribed here. The FDA did not approve it. And then these kids started being born that didn't have any limbs, or they had very stunted limbs. And this condition is called phocomelia. And to give you an example of what this looks like, here's a thalidomide baby. So phocomelia means seal-type limbs. And you can see these limbs, they're missing pieces, aren't they? So this little guy here seems to have hands and kind of is missing a wrist and has kind of sort of maybe an elbow, or maybe that's just the shoulder. So really from here to about here is just not there. Hand is there, shoulder's there, everything else in between there is missing. Probably when this part was developing, that's when the baby was exposed to the thalidomide. So that part essentially was deleted. And so some kids were born and didn't have any limbs at all. And because the legs developmentally are delayed relative to the arms, it wasn't at all uncommon for kids to be born without arms, yet have completely normal legs. You see this in development. Development tends to go from the anterior part to the posterior part, so it tends to be a wave that goes like this. So posterior structures are always delayed relative to anterior structures.
How long ago was that?
It was in the 1950s. Yeah, it was in the late 1950s, early 1960s. And yeah. So the drug, however, now has a second life as a treatment for multiple myeloma. And there's a relative of it, lenalidomide. Lenalidomide is used for leukemias, lymphomas, and what have you. So thalidomide, it turns out, interacts with this system in cells that breaks down proteins that you don't need. And thalidomide binds to one of the subunits of the proteasome, as it's called. So this is oh, I don't need this protein, I'll just degrade this. We'll have amino acids now, we can recycle the amino acids. When thalidomide binds to a subunit of the proteasome now becomes unregulated. And so now it starts degrading transcription factors. In particular, transcription factors that are required for the development of limbs. That's why the limbs tend to get hit the hardest. And that is also one of the ways it will help kill cancer cells. The cancer cell, which needs all these proteins that it has, now all of a sudden starts degrading all these proteins, and now the cell will start to give up the ghost. And that's why the drug now has a second life. But that's a drug you would never give to someone who's pregnant. I would commend to you the list, table 4.3. These are essentially medications that are known to be teratogenic, that you would never give to a pregnant woman. It's not a complete list, of course. But so ACE inhibitors, I would also include with ACE inhibitors, the angiotensin II receptor blockers, the ARBs. Another antihypertensive drug is related to the ACE inhibitors, functionally at least. And there's our old friend methotrexate that you would never give to a pregnant woman. And is lislenamide on there? No, it's not. But you can see here, essentially, there's thalidomide. And then, of course, tobacco smoking and so on and so forth.
So with this tobacco smoking, I didn't see anything in there about like marijuana. I just want to know what
So with marijuana, it's been shown that you get less tar and particulates in the lung than you do with cigarettes. Nevertheless, there's plenty of work that shows that marijuana does damage the lungs and does decrease the amount of oxygen you deliver to tissues if you smoke it. THC does cross the placenta. THC does interfere with neuronal development. So I would call THC a teratogen. Yeah. CBD, there's not that much work on CBD with that one. Then that doctor's an idiot.
That's what I said, but.
Yeah, no, you can quote me. That doctor's an idiot. No, the data on THC is clear. And if I can use a vignette from my wife who works in the school system, she says when you get kids whose parents indulged in Mary Jane while they were pregnant, she says you can tell. They have higher rates of ADHD. They have higher rates of opposition defiance disorder. They're uncontrollable. It does something to the prefrontal cortex. Animal studies have shown that rodents, at least, exposed to THC have less connectivity in the prefrontal cortex. So the doctor actually recommended they smoke marijuana during pregnancy. The guy or gal is an idiot. That's just full stop. Full stop. That's actionable. That is actionable. They should be sued. Now, CBD might have some efficacy for morning sickness, but you can take CBD, you can drop it on your tongue, and you can take it that way. Still, there's not enough data for me to say CBD is safe, but THC, again, the data is clear. The data is clear on that one. Yeah, no, you know my position on medical marijuana. I won't get into that here. You've heard that lecture before. I'll just leave it there. All right, we mentioned these in micro. You probably may have heard this and I promptly forgot it, but TORCH is an acronym for these organisms: Toxoplasma, rubella, cytomegalovirus, herpes simplex, and then O stands for others. So listeria would be another one that has a predilection for the placenta. These are various pathogens that can affect an unborn baby. Treponema pallidum would be another one, the syphilis organism. They can cause pretty profound defects in the nervous system, microcephaly, hydrocephalus, other types of issues, facial issues. Rubella, of course, affects hearing. You can have deafness, sometimes blindness as well. Cytomegalovirus can cause spina bifida and can cause motility problems. It can affect the cerebellum development. Herpes simplex too infects the central nerve. It has a tropism for the nervous system, and so on and so forth. So these are things that you can be screened for. Toxoplasma tends to be reservoired in cats. And so you might have heard that the advice, if a woman is pregnant, she should probably stay away from her cat, or she should not have a cat. If you don't have a cat, don't get a cat. If you have a cat, you're probably immune to Toxoplasma anyway. But you're not supposed to deal with the cat litter or something like that. Make hubby do it, so on and so forth. That can be one of hubby's jobs during that time in your life. Because Toxoplasma, again, has a predilection for the brain. The blindness I have in this eye is probably due to Toxoplasma, because my parents lived on a farm, and on a farm in California, you have to have a cat because there are just so many bloody mice. My parents had a cat. My mom had a chest cold when she was pregnant with my twin brother and me, and it all fits. So Toxoplasma could cause more than just eye problems. It can cause microcephaly, hydrocephaly. It can do lots of other things like that. So infectious diseases can also cause abnormalities. The number one cause of intellectual challenges, intellectual disabilities in children is 100% preventable, and it's fetal alcohol syndrome. So ethyl alcohol is a potent teratogen. It's most potent early in development. It's known to interfere with the function of a cell adhesion protein called L1. L1 is really important for neurons to be able to stick together to make synapses, for axons to be able to bundle together to make fascicles and things like that is quite important. Ethanol is known to interfere with L1. So it affects the development of the face. If any of you do peds, you'll become very familiar with the facial characteristics of fetal alcohols. In fact, you'll be able to go into a classroom and be able to pick the kids out because it's if you're familiar with it, it can be pretty hard to miss. Now, fetal alcohol syndrome is a gradient. Really heavily affected kids will have serious intellectual disabilities. Others will just have certain behavioral disabilities. Guys in particular will be more aggressive and they lack self-control and things like that. So it's a spectrum. So here are some of the facial characteristics. So you'll notice instead of the little dip you have here, the philtrum, there's no philtrum. The eye openings are small. Also, the eyes tend to be closer together. So this is the space between the nose and the mouth tends to be not nearly as big. The upper lip, see how the upper lip compared to the bottom lip is pretty thin. So the primordium essentially that makes the upper lip is different than the one that makes the lower lip. This is the maxillary process. That's the mandibular processes that grow together. And so the maxillary processes are very seriously affected, hence the small eyes and the philtrum and so on and so forth. And these are just the facial characteristics of fetal alcohol syndrome. The other, of course, is tobacco. Tobacco has an entire menagerie of things that are not good for the developing baby. And again, there's this direct dose response. The more you smoke, the greater growth reduction you have in the baby. Later on in fetal life, that's the time when the baby grows the most because smoking decreases oxygen delivery to the fetus. You get a reduction in growth, and low birth weight is common in parents who smoke. So it doubles the risk for low birth weight, increases the risk of small 4 gestational age in the newborn by 2.5-fold. You also have decreased fertility. You have increased rates of spontaneous abortion, increased rates of placenta previa, placentus abruptus, and preterm. Do you guys know what placenta previa is? The placenta forms right over the cervix. So once contractions start, the mom can bleed to death. It's a pregnancy has to be managed very carefully. Some OBs will say, "Oh, you're going to get a cesarean. That's just all there is to it." Others will say, "No, you can manage it." But early on, after the first ultrasound, it's common for the placenta to be low because as the baby grows, the placenta, as it adds tissue, the placenta will tend to move usually up to about the 3 o'clock position, shall we say, or 9 o'clock, I guess you could say, depending on which side of the uterus. So it's common with your first ultrasound for the placenta to be pretty low towards the cervix. No, once it implants, it implants. The growth will cause it to move usually, and it will usually move away from the cervix usually. There are cases where it'll move down over the cervix. Once it's positioned over the cervix later on, it's going to stay there. So yeah, there's just an increased risk of abruption and early delivery and what have you. And that's a tough one. Cocaine is a stimulator of the sympathetic nervous system. It's also a pretty powerful vasoconstrictor. That is going to, again, affect fetal growth, fetal development because of that constriction of the blood vessels. So there are several different types of developmental abnormalities that have been linked to cocaine abuse. It depends when cocaine is abused and how often cocaine is abused. So there's defects in the skull, you have skin issues, facial issues, facial and frontal bone issues, cysts in the open spaces in the spinal cord. You have the small intestine doesn't quite develop all the way, that there's blockage, heart abnormalities, lots of different types of heart abnormalities, and then various types of infarcts actually in the vasculature of the baby itself. So there's lots of risk, of course, from cocaine. Now, vitamin A is something you need when you're pregnant. But too much vitamin A is a bad thing. And there are drugs essentially that act as vitamin A derivatives. And so they will bind to the same transcription factors that vitamin A binds to. Vitamin A acts like a steroid. So it's able to go through the cell membrane. It binds to its receptor in the cytoplasm. That receptor now can enter the nucleus and elicit changes in gene expression. Retinoids are extremely important during development. Retinoids play a role in axial patterning. Axial patterning means this is front, this is back, and the expression of genes that tells you which is front and which is back are due to so-called Hox genes. So low levels of retinoids throughout the embryo essentially tell which Hox genes to come on where in the body. And so you get segments of the body that have different identities based on the nested expression of different Hox genes. Drugs like isotretinoin. Isotretinoin is a common drug that's given for acne. It is a very powerful retinoid. And so it will mess up Hox gene expression in the embryo. Usually what happens is that instead of the trunk forming like this, you get lots of anterior structures and no posterior structures. That's usually a baby that's not going to develop. So isotretinoin is very, very powerful teratogen. You get multiple malformations, typically that involve the cranium, the face, the heart, central nervous system, thymus, so on and so forth. And because of that, if this is your most powerful drug also for acne, it's taken orally. It's not a cream that you use for acne. The creams usually are okay because your absorption is pretty minimal. This stuff, however, you take orally. For that reason, women of reproductive age, if they have acne and they're prescribed this drug, they're almost always also prescribed birth control pills. That's to prevent getting pregnant in an unplanned way. Remember, 50% of all pregnancies are unplanned. And so it's for this very reason why those two prescriptions are normally given together. And if the parent objects to it, the provider will usually say, you don't get one without the other. So. Yeah. Diethylstilbestrol is not used anymore for the obvious reason. It's a teratogen. This was given essentially to help women become pregnant. So it was used to so-called support high-risk pregnancies for about 30 years. It is a steroid. Turns out that if you if you were born to a mother who took diethylstilbestrol, your risk of cervical and vaginal cancer increased substantially. Increased 2 to 3 to 5-fold. Furthermore, children born to mothers who used diethylstilbestrol had a series of developmental abnormalities. The ones that were seen the most were these problems with fallopian tubes. There were other things too, the problems with the clavicle and things like that. And yeah, just. So diethylstilbestrol essentially affects, again, Hox genes. It affects Hox genes that are expressed specifically in the reproductive tract and also up here in the pectoral girdle. And it causes those groups of abnormalities. So this drug, of course, is not used anymore. And its ability essentially to cause certain abnormalities are very clear. Now, again, doesn't affect the mother so much. It affects her baby. Even those babies who are normal, if they're female, they're at increased risk for cervical cancer later on in life. And then male fetuses were increased risk for these various things, hypospadias, where the penis is not formed normally, hypoplasia, testicular hypoplasia, cryptorchism, where the testes haven't descended properly, and surgically they have to be descended, epididymal cysts, epididymal cysts, so on and so forth. So these are all things that you saw with diethylstilbestrol. Notice diethylstilbestrol concentrated its abnormalities with one particular organ system, the reproductive system. Very good. So human development proceeds through 2 stages, not 3, embryonic and fetal. There is no pre-embryonic stage. That was made up. There is no stage. Cross that out. If you say there's a pre-embryonic stage, I will fail you. And you have those 3 primary germ layers, ectodermal, mesodermal, endodermal. Ectoderm gives rise to skin and central nervous system. Mesodermal gives rise to muscles, cardiovascular system, bone, glands, kidneys, gonads, things like that. Endodermal system gives rise to the gut, the GI tract, and associated structures. A third or so of all successful fertilizations will end in spontaneous abortion. 2/3 of these particular miscarriages will even occur before the mom even knows that she's pregnant. And then various drugs, various environmental conditions, they can cause developmental defects. And those defects are usually dose dependent and time dependent. The big zone is between 3 and 16 weeks. 3 and 16, not the first 2, because the embryo is not yet attached yet. It's not yet receiving materials from the mother. And the factors known to affect it, again, are dosage, time of exposure, and also the genotype of the embryo, of course. The number 1 cause of intellectual disability is fetal alcohol syndrome. Number 2 is Down syndrome. Number 3 is Fragile X syndrome. And the biggest teratogen that's on the market, at least, is isotretinoin. Isotretinoin. It's pretty potent. That's why when it's used, you use birth control pills as well. Any questions about chapter 4? Yes. Nope. Embryonic stage. The time from fertilization to implantation was designated pre-embryonic in the very late 90s, early 2000s. It was created out of whole cloth so that people who manipulated embryos to make embryonic stem cells could salve their consciences. Lee Silver says it in his book, and the reviewers who reviewed it agreed with it. They said, yeah, we made that up. So it's made up, there's no basis in embryology, so I am ripping it out of my terminology. And if that sounds like I'm bitter about it, it's because I am. So many of you have discovered this about me, but I have a very strong pro-life sentiment, and that will come out in my teaching. I don't apologize for that. When we get to the part in Farm where we have to talk about abortifacients, I will teach you about them, but I will do so with disgust. Because I think once fertilization is complete, you have a human person on your hands. That human person is immature. Can that human person get a driver's license? No. Does that human person have the right to vote? No. Can that human person support themselves? No. Oh, neither can a newborn for that matter. But I think as a complete human person, and to wantonly essentially disassemble that human person in the laboratory and then to try and solve your conscience by changing language, I just think is low, is ridiculous. Okay, why didn't that work? There we go, now it worked. Okay. Genetic counseling. So there's a whole field now in medicine of genetic counselors. If any of you do OB, or if you do family medicine, or if you do pediatrics, you'll undoubtedly do some genetic counseling. And you might need to refer people to genetic counselors if need be. So this chapter is meant to describe essentially what genetic counselors do. So genetic counselors will take the data from genetic tests, interpret them, and then relate them to the family in a way that they can understand. With that data, then the family is meant to make informed decisions about their family planning. So there are very often, let's say, for example, the test comes back and the genetic counselor tells the family, your child is going to have Down syndrome. Should you decide to have this baby, here's a support group for parents of Down syndrome children. If you want to contact them, here's their website, here's the contact person's card. That's the sort of thing they do. Your child will have hemophilia, here's a support group for parents of hemophiliacs, so on and so forth, blah, 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 what have you. So they're meant to not make the choice for the parents, they're meant to give the parents the information so they can make the choice for themselves. Now, genetic counseling, unfortunately, has a bit of a checkered past, simply because, I don't know if any of you are aware of this, but in this country, about the turn of the century, eugenics was very popular in this country. Do you guys know what that term means, eugenics? Eugenics means improving the human race through preferential breeding. So only people with the right kinds of genes should be allowed to breed. And who were those people? People who were white and Protestant and wealthy, essentially. So it became more of a class associated thing than anything else. So in 1930s, Germany was then led by a gentleman named Adolf Hitler, and he had a lot of eugenic ideas. You know where he got his ideas from? The United States. Some of the biggest eugenicists, intellectuals, were here in the United States. Margaret Sanger, the founder of Planned Parenthood, was actually one of the early eugenicists. You know where she put her first abortion clinic? In the African American community, because she didn't think they should be breeding. She was a eugenicist. Planned Parenthood doesn't like to point that out about their history. It's a fact. It has been documented. It's a fact. So unfortunately, this all culminated in the Supreme Court decision, Buck versus Bell. Anyone here heard of Buck versus Bell? So with Buck versus Bell, there was a young lady who actually turned out to be of normal intelligence. She was deemed by her doctors to be a quote unquote imbecile. And so the state said, we have the right to sterilize you. Because yes, this actually happened in this country. It's terrible, isn't it? But it actually happened. This was the thinking back then, and hopefully we've grown wiser since then. So the Supreme Court, it was the Chief Justice said, 3 generations of imbeciles is enough. Because the thinking was, well, if you're an imbecile, you can't take care of yourself. The state will have to take care of you. We all have to pay to take care of you and your kids, so you shouldn't be allowed to reproduce. And she was forcibly sterilized. They did this in Canada too. The whole Alberta sterilization laws and so on and so forth. That was the culmination essentially of the eugenics movement in this country. Thankfully, it died a inglorious death. And early genetic counseling, unfortunately, because most of the literature on genetic counseling was from the eugenics perspective, a lot of the early genetic counseling was tainted by some of this early eugenics thinking. So the first genetic counseling degree was given by this Sarah Lawrence College in 1971, because the only literature they had was literature essentially contaminated, if you will, by the eugenics movement. Genetic counseling had to have a come to Jesus movement, shall we say, to deal with some of this eugenics, this curse of eugenics. Well, a national society was formed in 1979, and then that was taken over by the American Board of Genetic Counseling, and then the American Board of Genetic Counseling split from the Accreditation Council for Genetic Counseling. It's now an independent board, and there's some board certified, a little over 4,000, probably about 4,200, 4,300, 4,500 or so. And there's 41, that's up now to about 43 now, accredited genetic counseling programs. Those programs are very hard to get into. They're very specialized. It's an advanced degree. It's a post-bachelor's degree. You get a certification. That certification allows you to practice as a genetic counselor. It's a unique blend, essentially, of medicine, genetics, and psychology and counseling and what have you. So your genetic counselors, they work with clinicians. So there's a clinical part to their training. They are investigators because they order tests sometimes. If they need information, they'll actually order the test. They're educators because they'll take that data, and they're also counselors. Now, there are some nurses who become genetic counselors. There are some nurses who get into the OB, the peds field, and they feel like they want to do this, and they go on to get advanced training in genetic counseling, and they end up becoming genetic counselors. So So when it comes to the genetic counseling part, the first session is usually a fact-finding session. So you do a genetic history. And by the way, that problem set that I told you about, where you have the couple with the hemophilia in their background, you have to do a pedigree. I would like you guys to do that over break, and it'll be due the Monday when you return. All right? So that's your over break assignment. Sorry? It's on Blackboard, yeah. I showed it to you, yeah. I showed it to you a while ago. It's, yeah, case study 1. And so essentially they do essentially what you're going to do in that assignment. You interview the couple, you ask questions, you get as much information about their history as you possibly can. You get information about miscarriages and stillbirths and what have you. This is quite important. And then you ask about ancestry, ethnicity. You try to determine if there's consanguinity in any case. You then do risk assessment. That risk assessment may require genetic tests that you order. You have to remember that insurance may not pay for all the tests. You have to be parsimonious in the tests that you order. You don't order tests that will give you superfluous information. You just order tests that will, what's wrong? You guys are all giggling. Oh, you're ready to, you swallowed a frog. Okay. And then you break the news to the parents essentially, and you put the informational cookies on as low a shelf as you possibly can. Not unlike what you guys will kind of do as nurses, huh? So it's a very nursey kind of field in some ways, and not unsurprisingly, most genetic counselors are women. Because one, I think women, because they bear children, they have more vested interest in the whole childbearing enterprise. Two, I think the whole compassion thing is just easier for women than it is for men. It's not to say men can't make good genetic counselors. I just think it's more in women's wheelhouse than it is, at least for most women, than it is for men. That would be my take on it. You can call me a sexist pig if you want, but that's my experience. I think after 60 some odd years, I've gained the right to have an opinion about such things. So there is a lot of supporting and crying on the shoulder and being a shoulder for parents to cry on and what have you. And you just, again, you don't make the decision for the parents. You give them what, you tell them what's what, and you let them make the decision, and then you grieve with them if you need to. So here's just an example, and this is from your book. So it's essentially on the slide here. So you have a 35-year-old woman. This woman is 12 weeks pregnant. She undergoes first trimester screening, and the result is screen positive. That indicates a 1 in 200 risk for her baby to have Down syndrome. So you essentially communicate this. The screening was positive, but it doesn't mean your baby has Down syndrome. It means there is a 1 in 200 chance that your baby has Down syndrome. The 1 in 200, that's less than half of 1%. So there's a 99.5% chance your baby doesn't have Down syndrome. And so, again, here's a nice example of putting the cookies on a nice low shelf. There's a room of 200 people, your exact age, same screening age. One of them would have a baby with Down syndrome, but the remaining 199 would not. I think that's a really nice way to communicate it. So is a chance 0? No, but there is a chance, and that's essentially what that test tells you. So genetic counseling now has become a lot more complicated with the advent of the Human Genome Project, because the Human Genome Project means we have the sequence of every gene in the human genome. So theoretically, if you have the right probe, you can screen any portion of the human genome. So early estimates based on number of cDNAs said that there were probably about 100,000 genes. That's been revised now to between 20 and 23,000. The function of 8,000 of these is known for sure. The function of another 5,000 are known probably, and the function of another 2,000 is known kind of sort of, and the rest of them we have guesses, and that's about it. So the number of genes available for which there are commercial tests available. In 1993 was 100, 2017 at 6,000. Now in 2022, that number is up to close to 10,000. So as companies essentially find ways to test for certain genetic conditions and they can make money off those tests, they will continue to design those tests. Yes, you can do karyotypes, but why do karyotypes when you can do microarrays that give you a lot more information? Microarrays essentially can give you ideas about copy number variants if you have bits of chromosomes that are duplicated or portions of genes that are expanded or something like that. Microarray analysis can tell you about that. With 454 sequencing, where you can actually get the sequence of a human genome in less than a day, you can even have the whole genome sequenced. Again, you're not going to order this unless you really have good reason to order it. And some 25 to 35% of kids that have birth defects of some sort, developmental delays, some sort of developmental issue, something like that, can receive a diagnosis through this technology. So that means essentially you have a chance of getting an answer with this type of technology. Now, insurance nowadays will not pay for whole genome sequencing. You need to pay for that on your own. And 454 sequencing is not cheap. But there are plenty of labs with the wherewithal to do this sort of thing. Think about the advances in computing that would take to be able to handle enough data from 3 billion bases of DNA. That's the other thing that's driven this, is the advances in computing and the miniaturization of the electronics that allows you to have a machine now that doesn't take up the whole room, that you can essentially fit on a desktop like this that'll do that type of analysis. All right, so you sequence a piece of DNA. So what? What does that tell you? It may not tell you anything. You can have variations in the sequence, but does that translate into some sort of genetic disease? Unless you have anything to compare it with, you don't know. So these variations in sequence that are known to be associated with certain genetic diseases, they're called variants of concern. Others are called variants of uncertain significance, or VU. And if you took French, VU means, I don't know, I took Spanish. It means you. It's the polite form of you. All right, so the breast cancer gene, breast cancer 1, breast cancer 2 gene, there are certain alleles of BRCA1 or BRCA2 that greatly increase your risk of breast and ovarian cancer in women, greatly increase your risk of prostate cancer in males. So it's not uncommon for parents to ask that these genes be sequenced. Okay, you get a sequence back, you compare it with the published sequence. Oh, we got changes here. that mean you have increased risk for cancer? You now have to go to the literature and you say, what particular variants are known to confer an increased risk? Those essentially will give you variants of concern. What if your variant's not in that list? Then you just have to say, you have a variant here. Does it translate to something with increased risk of cancer? We don't know. So that becomes a variant of uncertain concern. Now, as more data starts to accumulate, maybe it'll be clear that that variant is not associated with increased cancer risk, or maybe it'll come out that it is. So years later, essentially, you're going to have more information. When you see a genetic counselor, usually they will keep you updated on these sorts of things. That's the other thing genetic counselors need to do, is that they need to put in their computer, if such and such comes out, I need to contact this parent and tell them this or that or the other thing. All right, so variants are classified as pathogenic, that is, they're strongly linked with some sort of disease state. Likely pathogenic, you have evidence, but it's not strong evidence. It's moderate to strong evidence. Uncertain significance, the data is contradictory, or there just really isn't enough data on it. So that's so-called US, uncertain. Likely benign, there's moderate evidence that it's not associated with disease, or benign. Strong evidence, convincing evidence it's not associated with the disease state. I'm gonna stop right there. We'll stop right there. We'll pick this up then when you guys come back in 10 days. So have a great vacation, all of you. Don't forget your assignment. Enjoy yourself. Take some time off. Recharge.
Thank you. Bye.
You're very welcome. Have a great break, Stephanie.
You too.